Hi students. So this week I want to talk a little bit about super bills, okay? What they mean and the different components of an actual super bill, okay? So what is a super bill? All right. A super bill is an itemized form that's used by healthcare providers to reflect the services rendered from a patient, okay? There are several different types of information within a super bill, but there are four main categories that I just want to discuss a little bit. The first category I want to talk about is the provider information. Okay, so all super bills have a category that lists the provider's information. It's mainly lists the name of the provider and the credentials of the provider, as well as the service location that the provider completed the service for the patient. Especially if the provider has numerous different locations that they practice at, they always have to have that service location within the super bill. Okay, it also has their signature, which is highly important because when it comes to auditing and things like that with documentation, it's very crucial that a physician signature is within the super bill so that they can get reimbursed for the services that they provided the patient. Okay, the next category is the patient information. Here you want the patient's name, you want their date of birth, their social security number, any insurance information, their ID number with their insurance and things like that, the date that the signs and symptoms started occurring for the illness that they come to be seen for. That's also an important thing to get within the patient information. Also, the last date that the patient was seen. So that's always very important because that is crucial as far as insurance reimbursement with many insurance companies. Sometimes if a patient is seen very frequently, they'll get reimbursed less with their insurance, whereas someone that's not seen so often, their insurance sometimes will reimburse a little bit more. So that's very important to get that information regarding when they were last seen and also what they were last seen for. Okay, another category is the visit information. This is you want to list the date of service for the patients receiving any type of healthcare services, any type of codes, ICD 9 or 10. We'll be using 10 starting this month. So that is important. Any type of CPT codes, any authorization information from the provider, insurance company, anything like that. Things like that is very important to put within the visit information. Also, you have a section that has additional information. This is for any notes or comments that the provider or the patient would want to list. This is really important with insurance reimbursement as well, regarding the coding and things like that, and if there are any types of essential information that the insurance company might need to know for reimbursement purposes. Okay, so that's what a super bill is. It's just pretty much an itemized receipt, itemized paper that tells all the services that a patient has received from a healthcare provider and a specific facility. Okay, so I just want to talk a little bit about the meaning of that and what it entailed, and we'll be talking more about super bill within our discussion. So I'll look forward to seeing what you all have to say about it. Thank you and have a great week.